If you're in healthcare, you know sepsis is one of those big, scary topics. So today, we're going to make it crystal clear. We're going to visually walk through the entire story of sepsis, from that first trigger all the way to septic shock and organ failure. Ready? Let's jump in.
Here's our game plan. We'll start with what sepsis actually is, the body's wild overreaction. Then, we'll see how that spirals into shock. From there, we'll look at the terrifying domino effect called MODS. And then, the most important part, we'll cover exactly how to spot the clues and what you, as a nurse, need to do immediately to slam the brakes on this whole process.
All right, let's start at square one. Sepsis. This is where the whole crisis begins. And you gotta understand, the real enemy here isn't just the infection, it's the way the body chooses to fight it.
So, get this straight. Sepsis is a messed up, out-of-control response to an infection. It's like the body's defense system goes into full-blown panic mode. Instead of a targeted strike, it launches a massive, body-wide assault that ends up causing a ton of friendly fire, damaging its own vital organs in the process.
So what kicks this all off? Well, the usual suspects are bacteria, both gram-negative and gram-positive. But you can't have tunnel vision here. Literally any kind of bug. A virus, a fungus, even a parasite can be the trigger that sends the body into this chaotic tailspin.
Okay, so the body is overreacting. Now let's watch how that initial firestorm starts a chain reaction. This is where we move from a localized problem to a full-blown systemic crisis that we call shock. So you might be asking yourself, how on earth does that happen? How do we get from a simple infection in one part of the body to a life-threatening body-wide emergency? Well, it all boils down to a few key physiological steps.
First, that inflammation breaks containment. Instead of just fighting the germs in, say, the lungs, the body's inflammatory signals go absolutely everywhere. They flood the entire bloodstream, basically screaming, "Emergency!" to every single cell and vessel in the body.
And what does that systemic alarm do? It makes your blood vessels do two really bad things at once. First, they vasodilate, meaning they get super wide. Second, they become leaky. So picture your entire circulatory system, which should be a nice closed plumbing network, suddenly turning into a leaky soaker hose across your entire body.
And this is the heart of the problem. With all those vessels wide open and leaking fluid into the surrounding tissues, there's just not enough volume left inside them to maintain any kind of pressure. Your blood pressure tanks. And that means blood flow to your vital organs, your brain, your heart, your kidneys, slows to a crawl. They're literally starving for oxygen.
And that leads us right to the textbook definition of septic shock. This is when you've already tried to fix the problem by pumping the patient full of IV fluids, but their blood pressure still won't come up. It's a huge red flag that the circulatory system is in a state of collapse. Now, if we can't reverse shock fast enough, we enter the final, most devastating stage, multiple organ dysfunction syndrome, or MODS. If shock was the first domino to fall, MODS is all the others toppling in a line.
MODS is pretty much what it sounds like. That prolonged oxygen starvation from shock causes the organs to start failing, one by one. The lungs, the kidneys, the liver, they just can't function anymore. At this point, the body has lost its ability to regulate itself at all.
And for your exams, you need to remember this number. As soon as 3 or more organ systems have failed, the patient's prognosis becomes incredibly poor. It really highlights why our #1 job is to catch this process way earlier.
Let's just look at a couple of quick examples. When the liver, the hepatic system starts to go, you'll see physical signs like jaundice, and the patient's liver enzymes, their AST and ALT, will go through the roof. For the hematological system, things get really messy. The body's clotting factors go haywire, platelets plummet, and the patient is at a huge risk for bleeding. In both cases, your job is to support that failing organ while you desperately try to fix the underlying shock.
Okay, so we've walked down a pretty grim path, but now we get to the most important part. How do you stop it? And it all starts with one thing: recognition. You have to know what to look for.
Seriously, listen up. This isn't just about passing a test. Knowing these signs is about being the person who spots the crisis early and literally saves someone's life. So these next 2 slides are absolutely critical.
So what are you looking for at the bedside? Well, you're seeing the body trying to compensate. The heart rate and respiratory rate crank up. The blood pressure starts to sag. And never, ever ignore a change in mental status. Confusion or lethargy can be one of the very first signs that the brain isn't getting enough oxygen.
And the labs tell the inside story of all that organ stress.
You'll see high blood sugar, white blood cell counts that are either crazy high or crazy low, and dropping platelets. But the big one to circle here is hyperlactatemia. A high lactate level is direct proof of tissue hypoxia. It's the lab value that screams, the cells are starving.
Okay, you've seen the signs, you've got the labs, your patient is septic. The clock is ticking loud, so what do you do right now? This is all about fast, decisive action.
Here it is, your sepsis action plan. Number 1, fluids, fluids, fluids. Hit them hard and fast to fill up that leaky tank. Number 2, and this is crucial, get blood cultures before you hang the antibiotics. You need to know what you're fighting. Then, start those broad-spectrum antibiotics. Number 3, if fluids alone aren't cutting it, it's time for vasopressors to help squeeze those vessels and get the BP up. And all the while, you are constantly monitoring everything, ready to support any organ that starts to struggle.
Look, sepsis is a devastating cascade, a true race against time. But here's the thing, it's a cascade you can stop. It all comes down to knowing the path it takes, seeing those early signs, and acting with confidence. So, the real question is, when you see it happen, will you be ready?